disability is a self-explanatory word, yet nobody understands it. The word next to it becomes very important. Neurological disability, physical disability. Most people understand physical disability because it's visible. Somebody doesn't have a hand, somebody is limping while walking, or somebody has certain other things. You can see the physical deformity. Ayo papa, you say this guy is having this problem. Fundamentally, what we call is infections or infectious diseases or communicable diseases. What people are not seeing is the non-communicable diseases like blood pressures, diabetes, coronary artery disease, heart problems and things like that. To these two, the third fellow is getting added now, is called neurologic disability.
Before, I couldn't sleep at night. For full night I used to have pains and I used to be shouting, crying, everything.
So this is becoming a big epidemic. This is called acquired brain disease. That's one epidemic, a neurological disability. On the other side, you have children being born with developmental disabilities. The autistics, the difficulty during childbirth and so on and so forth. But what most people do not see in the neurological disability with respect to the brain is a software disability. The person looks okay, but he's not okay. Now that is something that most people don't understand. There is a study done by NIMHANS. This is a 2010 study. 3 neurological conditions, which is traumatic brain injury, number 2 is stroke, and number 3 is age-related dementia. Dementia is loss of memory. They are saying that there are 40 lakh Indians are getting neurologically disabled every year just because of these 3 conditions. So if 40 lakh people are out of circulation today, who should have been contributor citizens of this country, imagine what's going to happen. See, I have patients, parents of patients, young guys, 15, 25 years, who had a road traffic accident, disabled, can't manage themselves. The mother comes and asks me, Doctor, he can't clean himself after he goes to the bathroom. Today, as a mother, I'm taking care. Once I die, who will clean him? So can you imagine, the family does not have big requirements. They want fundamental things, which I think is the fundamental human right that we have to do. But what is happening is the acute care is happening, but after that nobody has the interest to take care of all of this, because these takes months to years to make it happen. So the question everybody is asking is, why is this happening? Is there something wrong in the diet? Not at all. It's more than that. Is fundamentally the fact that that one is the numbers, and secondly, like I said, because the acute care has improved, people have better access to primary care at a decent hospital, they're all surviving. Others, they would have died in the past. Now those people who are surviving are disabled.
Human brain is something which very commonly we talk that there is a hardware and there is also a software. So because this is the only organ I can say in the body that has both these things. It has its own way of working, which is very different from the other organs in the body. So obviously from the time the child is born to the time the person dies, there is so much of evolution which happens in the human brain, like the development of the circuits and the learning and relearning, forgetting some things, and if there is a trauma or something happens, there can be non-functioning of different areas of the brain. The brain has different areas which controls different functions in the body, right? So now in rehabilitation, what I look at is from that perspective, how can we get back the functioning, that is the software of this human brain back to how it was before, or I can't say 100% back to, or at least how close can I get back to the initial functioning, how it used to be earlier before this impact happened to the brain.
Many people in India think treatment is something like giving injections or doing surgery. Once it's over, when the stitches are removed, the treatment is over. Actually, that is wrong. Basically, the treatment should continue till the patient is back to his normal work, at least to the level of self dependence. So, a rehabilitation program is a very important factor, because many of the patients will have their own variety of deficits with respect to what disease they have, and they have to be either trained or they have to be given good prolonged physiotherapy so that the functions recover back to the normalcy, or just to the level that they can be self dependent.